Hello everyone, my name is Ashley Fisher and I will be presenting on Epidermodysplasia Verruciformis. So what is Epidermodysplasia Verruciformis? It can be called numerous names, but for this presentation we'll just leave it to 3. It can be called EV for short, Tree Man syndrome, or Lewandowski and Lutz. EV is a rare inherited disease characterized by the human papillomavirus, which puts people at risk of developing skin cancer. And since it was first identified in 1922, there have been approximately 600 cases reported. Characteristics of EV include hyper or hypopigmented flat wart-like papules or patches of raised and inflamed skin. In extreme cases, lesions will resemble tree bark-like skin. Here we have 3 examples of Epidermodysplasia Verruciformis, ranging from least extreme on the left to most extreme on the far right. If you look at the far left picture, you will notice the hypopigmented plaques on the forehead. In the middle picture, you have a young lady with papules noted on her nose, and also tree bark-like lesions throughout the chin area, cheeks, as well as on the ears. All areas that can be exposed to the sun. And in the far right picture, you have the young man with the extreme case of tree bark-like lesions on his hands. EV is an autosomal recessive disease that can be passed down to offspring. The mutation of this disease occurs inside of chromosome 17 and 2 adjacent genes, either EVER1 or EVER2. These genes prevent the entry of proteins to zinc, resulting in restricted growth, which is needed for proper immune system function. If you notice any of these symptoms mentioned earlier, you should seek medical attention immediately. Your doctor may recommend that you see a dermatologist, where they will review your past medical history and also start to seek treatments for you. It is to be noted, however, that HPV that is tested during the biopsy does differ from the HPV that leads to cervical cancer. The HPV in cervical cancer, the DNA is HPV 16 or HPV 18. There are currently no cures for this disease. However, there are a few treatments, which would include surgery, cryotherapy, which freezes off any lesions, topical ointments, and also dermatologists would recommend limiting your sun exposure. There are genetic studies that are currently being done, and they are to find further genetic linkage for possible cures for this rare disease. If you would like further information regarding Epidermodysplasia Verruciformis, you can look throughout these resources. And as always, thank you for listening.